What is clinically significant depression? Clinically significant depression, also known as major depressive disorder (MDD), is a serious mental health condition characterized by persistent feelings of sadness, hopelessness, and loss of interest or pleasure in activities. It is one of the most common mental health disorders worldwide and can significantly impair an individual's ability to function in daily life. Symptoms. The symptoms of clinically significant depression can vary from person to person, but typically include persistent sadness, feeling sad, empty, or tearful most of the day, nearly every day. Loss of interest or pleasure, losing interest in activities once enjoyed, including hobbies, socializing, or sex. Changes in appetite or weight, significant weight loss or gain, or changes in appetite, increased or decreased. Sleep disturbances, insomnia, difficulty falling asleep or staying asleep, or hypersomnia, excessive sleeping. Fatigue or loss of energy, feeling tired, sluggish, or physically drained, even after restful sleep. Feelings of worthlessness or guilt, feeling worthless, guilty, or excessively self-critical, even when there is no logical reason to feel this way. Difficulty concentrating, trouble focusing, making decisions, or remembering things. Psychomotor agitation or retardation, restlessness or slowed movements in speech observable by others. Suicidal thoughts or behaviors, thoughts of death or suicide, suicide attempts, or self-harming behaviors. Diagnosis. Clinically significant depression is diagnosed based on a thorough assessment of symptoms, medical history, and physical examination. Diagnostic criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, are used to determine if an individual meets the criteria for major depressive disorder. Causes. The exact cause of clinically significant depression is not fully understood, but is thought to involve a combination of genetic, biological, environmental, and psychological factors. Risk factors for depression may include genetics. Family history of depression or other mood disorders may increase the risk. Brain chemistry. Imbalances in neurotransmitters such as serotonin, dopamine, and norepinephrine may contribute to depression. Life events. Trauma, loss, stress, or significant life changes can trigger or exacerbate depression. Medical conditions. Certain medical conditions, such as chronic illness, hormonal imbalances, or neurological disorders, may increase the risk of depression. Treatment. Treatment for clinically significant depression may involve a combination of therapies, including psychotherapy, cognitive behavioral therapy, CBT, interpersonal therapy, IPT, and other forms of talk therapy can help individuals identify and address underlying issues contributing to depression and develop coping skills. Medication. Antidepressant medications, such as selective serotonin reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs, may be prescribed to help alleviate symptoms of depression. Lifestyle changes. Healthy lifestyle habits, including regular exercise, balanced diet, adequate sleep, and stress management techniques, can support overall well-being and may help alleviate symptoms of depression. Supportive interventions. Support groups, peer support networks, and involvement in community activities can provide emotional support, validation, and encouragement for individuals with depression. Prognosis. With appropriate treatment and support, many individuals with clinically significant depression can experience significant improvement in symptoms and quality of life. However, depression can be a chronic or recurrent condition for some individuals, requiring ongoing management and support. In conclusion, clinically significant depression is a serious mental health condition characterized by persistent feelings of sadness, hopelessness, and loss of interest or pleasure. With timely diagnosis, appropriate treatment, and support, individuals with depression can achieve meaningful recovery and improved well-being.